Hello, this is Dr. Reilly, and today I wanted to talk to you a little bit about non-alcoholic fatty liver disease, or as you'll see, probably should be called fructose-related liver disease. As you probably know if you're watching this video, I'm triple boarded at pediatrics, obesity medicine, and also in clinical lipidology. So why do we care about non-alcoholic fatty liver disease? We care because of of this, where we can have, especially for me, I'm a pediatrician, poor a little kid with liver problems, and they all start out with healthy livers, and then they progress to this fatty liver, which is very common in adults, right? But unfortunately, adult doctors, they don't really tell people that they could start out with their fatty liver and then they can end up with the cirrhosis, which is actually not good, right? Now, this is always kind of very strange to me because we're ordering liver function tests all the time. And one of the things that we know when we order the liver function tests is that there is like a premium or a sweet spot where you really want your liver functions to be at, and it's not high like it says in a lot of the reference ranges. It's actually fairly low. If you look at this kind of graph, this is old men like me, but you could see that really where you want to live is somewhere between 12 and 17, and that's associated with the lowest all cause mortality. This is actually what this graph is trying to show, is that the lower your ALT, which is one of the liver function tests that we use, then the longer you live and the less all kinds of problems that you get. So you would think that when you get your blood tests, then it should say the optimal level, but it doesn't. And the next blood test that comes back like that will be the first time I ever see it. And you would think that this would be something super important, that they would actually put this on all kids' blood tests, but they don't, right? And this is actually a problem. This has been shown since this study was done in 2009. And the pediatric GI people, once it was done, they actually realized this. And in their official statements, they say that, yeah, that a lot of the normal values that we think are normal for a liver function test are actually not so normal. And for kids between 12 and 17 should be, depending if you're a boy or a girl, 25 or 22 is the upper limit of normal. And really probably the ideal should be less than that, as we saw from the previous graph. And this is one of the reasons why we have such a problem with non-alcoholic fatty liver disease, because there's a lack of knowledge among us, among the docs, as what is the best liver function test that we should be actually shooting for. And unfortunately, this can be shown on this graph, which is a graph that shows us the rates of liver transplants. And luckily, the rates of liver transplant through hepatitis C or related to hepatitis C have gone down. But you could see at the same time, alcohol and non-alcoholic fatty liver disease, they've gone up. So that's not good. And it's not just us in America, it's the whole world has this kind of problem. And non-alcoholic fatty liver disease seems to live together with diabetes. And a lot of people feel like you have to start getting some non-alcoholic fatty liver disease before you actually start getting diabetes. So it's actually not surprising. And this is actually one of the reasons why we're all in such big trouble with our healthcare, because this is what's getting us into trouble like everywhere in the world. Now, what is the difference, right? Because they sound kind of the same, non-alcoholic fatty liver disease and alcoholic fatty liver disease. And when I was a young doctor, we didn't really know about a lot of this kind of stuff. Even with looking at the lab values, I remember some of the older residents telling me not to pay attention to the reference ranges, that every lab has them a little bit different. And I think they just told me that because they didn't really know the answer, right? But now I'm an old doc, I know the answer. And the same thing with what's the difference between non-alcoholic fatty liver disease and alcoholic fatty liver disease. And it's basically that there's not really too much of a difference, except alcoholic liver disease is caused by alcohol. Non-alcoholic fatty liver disease is caused by fructose, right? And so here I have a picture of Dr. Lustig. He is kind of one of these famous pediatricians who has been kind of telling us all about the effect of fructose on the liver. and how it's metabolized. And he has some very excellent videos on YouTube if you care to learn more about this kind of stuff. But yeah, it's fructose. Fructose is the problem. Fructose causes non-alcoholic fatty liver disease. It causes an increase in chance to get type 2 diabetes. It causes a lot of the abnormalities of the blood vessels that we see and high blood pressure. And they've done studies like this where they give people fructose and they're able to raise very quickly their blood pressure. It does make people gain weight, which is sort of how I've kind of come to figure out a lot of this kind of stuff. But yeah, usually what we have to do is we have to just kind of now take this information and educate the patients that it's fructose, fructose, fructose. Fructose is the thing that causes the problems. Fructose is the problem for non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease starts much earlier than anybody has ever been told before, and that the ideal levels of liver function tests are much lower than anyone has ever thought, right? So this is the problem, because when you try to explain this to people, what foods have fructose in it, and I've had patients, they like to, Dr. Reilly, fructose is in everything. Well, usually if we're having this discussion, it's usually in everything they're eating. It's not in everything, right? Steak does not have fructose in it usually. But it is the kind of thing that we have to just be aware, especially when we start seeing that we have it elevated, that we have problems with non-alcoholic fatty liver disease, that we have to actually start to lower the foods and look for fructose in everything that we're eating, especially if it's a processed food, which in reality, most of the processed foods are going to have something in it that's actually not so good for us, right? Like for example, here, number 10, French dressing has fructose in it, but it also is more likely to have some of these vegetable oils, which also have been shown to cause non-alcoholic fatty liver disease. So this is especially why high fructose corn syrup is bad for us, because we already have kind of seen that fructose is bad for us. So you can imagine anything that's high in fructose is going to be super bad for us. And agave is one of these things, for example, is pure fructose. That is super bad for your liver and not healthy, and people have stopped to use it. So what do you do when you have somebody with non-alcoholic fatty liver disease, when you have your consults with them, Dr. Reilly? Well, normally the first thing we do is we get rid of the fructose, because how do you get better from, for example, alcohol liver disease if you keep drinking alcohol, right? So since we know it's the fructose that's causing us to have the non-alcoholic fatty liver disease, what we do is we get rid of the fructose, and then we try to replace things that are going to give us all the different nutrients that are important for our liver. And these are things like egg and fish and things like that. Certainly liver is probably the best thing to eat when you're having liver problems. And there's different ways that you can eat liver. Certainly, probably the most common way that parents are able to get kids to eat liver is to kind of to buy some ground pork, ground chicken, ground turkey, or something like that, and just mix it together with some chopped up livers. And that usually kind of makes it have a little bit like the taste of actually like ground beef. And but it has all the nutrients from the liver and things like that. And then, they put it in with tomato sauce or something like that. Most kids will love anything with tomato sauce and Parmesan cheese and things like that. I put here olive oil because certainly when they look at people, when they switch to the Mediterranean diet, it seems like it's actually very good for your non-alcoholic fatty liver disease. And probably because a lot of those studies, what they did was actually they gave them olive oil and asked them to refrain from these other kind of inflammatory seed oils. And it seems like anytime you do something like this, it's actually good for the liver. So yeah, so these are the things that we're going to be focusing on. Something like healthy, like eggs for breakfast, especially the yellow of the egg has a lot of stuff in it that's actually good for us. And it also has a lot of the nutrients that are usually going to be helpful for us in terms of like healing our liver. Usually it's the kind of thing that it also means that they're not going to be having cereal, which is usually almost half fructose in some of these cereals. We're going to try to get them to eat like real old style kind of foods that's going to be helpful for us. Timing is certainly super important, as this poor penguin found out, that your liver needs you to be resting and not eating for it to heal. So you can imagine your liver has a job to do, it's to digest food. So if you eat something right before you go to bed, it's going to be working while the rest of your body is trying to go to sleep, and then it's not going to be able to heal itself. And since when you're having elevated liver function tests, your liver is inflamed, you need it to be like you need your body to be resting so that way your liver can actually start stopping the digesting process and start the healing process. So this means eating breakfast as late as you possibly can and eating dinner as early as you possibly can, and then no snacks after dinner. So this is the problem for non-alcoholic fatty liver disease. When I was a young doc, I used to think like, "Ooh, I'm so smart. I figured out that this person has non-alcoholic fatty liver disease. I'll send them to the GI specialist." And unfortunately, because there is no medicines for the non-alcoholic fatty liver disease, they more often than not, or almost 100% of the time, were sent back to me without any treatment because they felt like there was no treatment for non-alcoholic fatty liver disease. So then I ended up trying to teach myself, right? So what am I supposed to do when I have these poor kids who have non-alcoholic fatty liver disease? And what I realized is although there's no medicines that are good for non-alcoholic fatty liver disease, there are treatments. And certainly the most effective treatments are changing the diet, avoiding things with fructose, and making sure that the person is eating food in a proper timing pattern so that way their liver gets a chance to heal. But there are other things that we can do that are actually good for the liver, and none of them have a lot of side effects. So they're actually all very nice, and I've used them all in the past to help kids to normalize their liver function tests. Normally, what I try to do is I actually try to get them to change their diet, sleep, etc. And then we usually repeat their liver function tests. We repeat their liver function tests usually like in a couple of months because the liver has an amazing ability to heal itself. And the younger they are, the more likely it is that their liver function tests are all completely back to normal within a couple of months. But if they're not completely back to normal, and there has been no misstep by the parents, meaning that they misunderstood me or they didn't do something because I don't know something bad happened in their family, then our next step is usually to try to introduce something and then like the next few slides. So one of the things that usually works fairly well is something called non-acetylcysteine, right? So our NAC is more commonly known, and this is available on Amazon. It actually was in short supply for a long time during COVID because of its strong anti-inflammatory effect. It was felt like it was actually going to be something that was very good for when people had non-alcoholic, when they had COVID. Now it's becoming more readily available again, and we can actually use it. There are definitely many studies that show that it's actually very good for healing the liver, and it does this through its antioxidant effects, which its antioxidant effects are through glutathione, which, as you know, if you remember, is actually very important in terms of the inflammatory cascade in the liver. So the NAC is very good, and in this study they compared it to vitamin C, which is interesting because vitamin C is also an antioxidant, but it's actually much more important outside of the liver, but actually making sure you have a normal vitamin C level, which unfortunately I have a few patients that they have low vitamin C's even because of their diet. It is the kind of thing that usually using both wouldn't be bad, but certainly the N-acetylcysteine is really what does the heavy lifting when it comes to non-alcoholic fatty liver disease. Coenzyme Q10, also something available everywhere, Amazon, etc. Very good at lowering your liver function tests in combination with vitamin E. It seems to work very nicely. And again, it's an antioxidant. Again, it does seem to help more in the liver than it does in other parts of the body, and it would actually help us to resolve some of the non-alcoholic fatty liver disease. But once again, resolve it, but this is after we've kind of admitted failure, that the person is still having fructose in their diet, even though we've tried to remove it, right? Because really, almost 100% of the time, when you remove fructose from the diet, the person gets better. But sometimes we're faced with teenagers who, although they might give lip service to me in the room that they want to actually get rid of their non-alcoholic fatty liver disease, they are still, drinking Gatorade or having Cokes with their friends or eating other foods that are high in high fructose corn syrup. And when you're faced with that kind of stuff and you have a parent that's willing to help their kid, then these are some of the things that we can use. This is a medical grade probiotic called Visbiome. And probiotics as you'll see from this reference, they do actually seem like they can actually help with non-alcohol fatty liver disease. And this is one in particular that I've used, especially when I was able to get samples of it. And I can sometimes get it covered through the insurance, but it is fairly expensive, right? So a few months supply is over $100. So usually it is something that this is kind of reserved for people who have either excellent insurance or the ability to pay. Vitamin E is probably super cheap, and that also there are plenty of studies that seem to show that it does have some effect in terms of non-alcoholic fatty liver disease. But it always is a problem with things like when someone just gives vitamin E, because if you give them vitamin E and expect vitamin E to undo the damage from the fructose, then you're going to be sadly mistaken, because really the food is always much stronger, right? And I think it's much easier to think of this like alcohol, right? It doesn't matter if you have something that's going to help with the liver disease. When you have alcohol liver disease, if you keep drinking alcohol, you are in big trouble, baby. Omega-3 fatty acids, yeah, those things are good for everything, man. Now, just the only thing is, remember that it can't be plant omega-3 fatty acids. Those things don't seem to do anything. But it is the kind of thing, the marine omega-3s, which mainly you can get from fish. But there are supplements, but you have to be careful what kind of supplements you buy, because a lot of the supplements are spoiled, and that is one of the reasons why sometimes they'll look at studies and they don't seem like they do as much good, is because they use omega-3 supplements that actually were kind of spoiled. And so you want ones that are third-party tested to make sure that they're actually still doing okay in terms of like the omega-3 that they provide. But certainly the best way is through food, right? And the AP now recommends for people to have fish twice a week. And really, it's the kind of thing, fish is really the best way. So if you do have a family history for non-alcoholic liver disease, it's not bad to try to get the kids to start eating more fish when they're littler. But you can get eggs which have omega-3 fatty acid. There are other workarounds. There are good supplements, like from Nordic Naturals. They seem to be a company that's trustworthy, where they're actually producing the omega-3s in a good sort of way. But we have to be, with the ideal point of view is supplements are for the time being, but we need to be healthy the rest of your life, you have to learn a healthy eating pattern. Zinc, especially for kids, when they're growing, they can become low in zinc, because you need the zinc, which is a mineral, to help you to grow. And it has been shown that if you supplement people with zinc, that it does seem to help with the non-alcoholic fatty liver disease. Carnitine, which is found in all sorts of meats, also is helpful, especially if you have someone who is a vegan. They're more at risk for this kind of stuff. And for vegans, it actually seems to help them with a lot of other issues in terms of focusing and a lot of the things that they're predisposed to. PCOS and NAFLD, they kind of go together, right? So this is when I see kids for a consultation and have a little bit older girl, this is one of the things that we usually will see, is that they'll have PCOS and they'll have NAFLD at the same time. And it is actually a much more of an issue for them. We could see that from this graph that a lot of the control girls, they won't have the non-alcohol fatty liver disease. But as soon as they start having the PCOS, or they're starting to have an increased BMI, then it starts to increase, right? So we have to be a little bit more cognizant, and there are actually things that we can do. We could see that, for example, we can look at the sex hormone binding globulin, and that will actually be letting us know that they're more at risk for some of this kind of stuff. One of the things that we'll use sometimes for PCOS is spironolactone, and they've looked at that, where you give spironolactone and vitamin E at the same time, seems to actually be helpful. And berberine, which is something that's available, again, over the counter, which is an herb that actually seems like it's helpful for PCOS, seems like it helps also for non-alcoholic fatty liver disease, kind of not surprisingly. One of the things I was surprised as I was preparing for this talk was psoriasis seems like it's related to non-alcoholic fatty liver disease. So certainly doing some of these interventions in a patient who has psoriasis sometimes could be very helpful. And I've actually seen that, where I change people's diet and their psoriasis actually gets better. And then the last thing I wanted to talk about was a medicine that sometimes we'll use this for kids who are overweight, and it's topiramate is a medicine that we can use for migraines, but it has a well-known side effect of helping kids with weight loss. And since a lot of times it tends to be these kind of eating patterns that predispose the kids to non-alcoholic fatty liver disease, then these guys have looked at that, where they look to see if you used pyramide, whether or not that would help, and it seems like it does help, as you might imagine. So that was basically everything I wanted to talk today about non-alcoholic fatty liver disease. Hopefully you found it interesting and helpful, and gives you insight into what like the obesity medicine specialists and people like myself actually do when we're faced with a child who has non-alcoholic fatty liver disease. And it'll give you kind of an idea of things that you can do that will kind of help you and your patients take care of this non-alcoholic fatty liver disease, which is very terrible and unfortunately a worldwide problem. All right, so I'm Dr. Reilly. Again, if you have any questions, then you could just hunt me down in my office at RBK Pediatrics or on the web at rbkpediatrics.com. Thank you.